All day, I answer patients' questions when it comes to knee pain. Why does my knee hurt? Why did it do this? What is arthritis? What can I expect going forward? And today's video is going to be sharing with you all of the analogies and metaphors that I've used over the years to help people like you understand what's going on with their knee. Hello and welcome back. My name is Adam Rosen. If you have not checked out my channel before, please subscribe and click the thumbs up button if you like this information. It does really help the channel. And for those of you that have watched my channel, truly welcome back. At least a lot of you know that I took time off this summer. I launched my new book, OR Confidential, so you can check that out. It's available on Amazon. Got my youngest off to school, and now I'm getting back into the swing of things, and I'm coming out with some new videos. And I hope that you'll like the next few videos that I have planned. They're a little bit more fun for me as opposed to covering one specific topic. I'm going to kind of cover things that I discuss with patients on a regular basis, go over some x-rays, show you some things that you might find interesting. And that's what today's video is going to be about. So today's video, I'm going to share with you all of the analogies and metaphors that I have used to help people understand what knee arthritis is and why does their knee feel the way that it does. So the first thing I always explain to people is, what is arthritis? Because a lot of people don't know what it is, or many people think it's this buildup. It's like a buildup like rust, and that's why they think we can go in there arthroscopically and clean up their arthritis by scraping it off. And if you've read my book, you've seen the analogy that I use, that if your uncle gave you, old 5-inch, piece of wood cutting board, and it was passed down through generations, and it was really beat up, you could take it down to the garage and belt sand 1/4 of an inch off, and now you have this beautiful cutting board, which is 4 3/4 of an inch thick. The problem is that arthritis is not like that. It's not a buildup, and there's not healthy cartilage hiding underneath there. So we're born with about 3 millimeters of cartilage. If you lose a little bit of cartilage, say 1 millimeter, you have early or mild arthritis. And that space on your x-ray is a little bit narrowed. If you then lose another millimeter of cartilage, you have 1 millimeter of cartilage left. This is more advanced arthritis, where that joint space has just a sliver of space remaining. And if we went in there arthroscopically to clean up your arthritis and remove that remaining one, guess what? Now you're bone on bone. So we can't make you better with arthroscopic surgery if you've lost cartilage. We don't have a way of putting cartilage back in the knee. And that arthro, kind of Latin for joint-itis inflammation, this is inflammation of the joint because of increased friction and irregularities in the surface. So when I try to explain to people what is actually going on in there, what it looks like, the analogy that I like to use is of a hard-boiled egg. So if you peeled a hard-boiled egg, it's very smooth, shiny, and white, and it's quite firm. And your cartilage is similar to that. It's smooth, shiny, and white, and quite firm, and it glistens. And there's a fluid film layer. So just like if you had a Scotch glass with a little bit of ice on the rocks on a glass bar, you get a little bit of condensation, and that glass can slide back and forth. So cartilage and cartilage, there's a little membrane of fluid, what we call synovial fluid, and that allows the knee to glide. But as you develop arthritis and you lose that cartilage, it starts to deteriorate. You get little cracks and fissures like a mosaic painting. Pieces of that stuff start to flake off. And then you get this roughened surface, which is starting to cause friction and inflammation. And the other thing that it does is create noise, what we call snap, crackle, and pop, or Rice Krispies. So the analogy that I think makes sense to most people is that if you drove down the highway, say it's concrete or asphalt, it makes a little bit of noise, but for the most part, it doesn't make much noise. You're driving very comfortably. Now you drift over to the side of the road where the rumble strip is, which is also made of concrete or asphalt, but it is irregular. And very quickly, you and everybody in the car hears this loud bum, 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 bum. And your knee does the same thing. So as you develop arthritis and you develop these little cracks and fissures and ridges, when you bend and straighten or kneel down or get out of a chair, you're going to hear that snap, crackle, and pop. And we don't have a way of fixing that. Even years ago, we used to think about going in and doing what's called a chondroplasty, where we would shave the cartilage down to make it look smooth to the human eye. Even for a while, we used lasers, which actually would heat up the cartilage and shrink it. And again, it looked kind of smooth to the human eye, but it didn't fix the problem. It didn't solve the issue with the arthritis because it didn't add cartilage back, and the cartilage continued to deteriorate. Now, going a little bit further, a lot of people have pain inside their knee, and they're trying to figure out, well, what actually hurts? And the honest truth is a lot of stuff, and we're not really sure. So the lining of your knee, what's called the synovium, Basically, think of it as a bag that surrounds all of our joints. It's why athletes get water on the knee. It's contained, but even the small joints in our finger have a capsule which is surrounded by this stuff called the synovium. And that lining is like a thin rain jacket. It is paper thin in a normal knee. But what can happen in an arthritic knee is it starts to get thicker and puffier. So that's why you have this swollen looking knee. I always say like that synovium goes from a rain jacket to like an 800 fill goose down jacket. It's very puffy and round, and knees look round. So people will come in constantly and say my knee is swollen, but it's not fluid, meaning I can't put a needle in there and drain it out and make your knee look normal. That tissue is thickened because of your arthritis. So the knee always looks round. It looks swollen, but it's not full of fluid. And when we do surgery, the same thing can happen. So if you have a round knee before knee replacement surgery, and then we open up the knee and do the surgery, you're going to develop even a thicker sort of rind, and that knee will look round. So a lot of people after knee replacement surgery complain that their knee is still swollen, even years down the road, or it's not technically fluid. It is thickening of the lining of your knee. Now, that synovium also tends to be very hypersensitive. So when I give cortisone injections, I kind of wash the skin and I spray it with a cold spray. And I always tell people, you're going to feel a little pressure because the skin is numb, but then inside you're going to feel a pinch. And sometimes that pinch is more than a pinch. But that needle goes through the synovium, and that synovium is inflamed. So if you look at the synovium inside a normal knee, it's almost peachy, kind of yellowy looking tissue. It looks very smooth. It's very thin in nature, and it looks very healthy, to be honest with you. When you develop arthritis, that tissue, that synovium, gets beefy red. Sometimes even in certain cases, it looks like a red sea anemone in there. There's all these little fronds sticking out. But the analogy that I like to use for that is if you're a little kid and you skinned your knee on the playground, and now 2 or 3 days later, that skinned knee turns into a bright red raspberry, and sometimes it drains fluid. That's what your knee is doing on the inside when you have arthritis. So what happens is it hurts, it's sensitive, especially to the touch. And just like your raspberry can leak fluid, this inflamed synovium can leak extra fluid, which is why a lot of arthritic knees tend to get swollen. And there's not a great way of fixing that because the underlying cause is the arthritis. We can reduce the pain, inflammation, and swelling with oral anti-inflammatories or topical anti-inflammatories or injectable anti-inflammatories, but that is just treating the symptoms of arthritis. The only way to truly fix arthritis currently is knee replacement. Everything else is there to treat the symptoms of arthritis. And the last analogy that I'll share with you, because this holds true for whether or not you have a normal knee or an arthritic knee or even a replaced knee, where sometimes people get this sudden sharp pain, like really, really sharp, almost like drops you to the floor, knee buckles and gives way sort of thing. And there's two things that I use when I describe that analogy. Now, one way is the sharp pain due to arthritis pain, which is more commonly when people say, my knee just completely gave out and buckled it. It's unstable. And we examine the knee and it's stable. So it's not unstable to manual testing. The ligaments are stable, but to them, the knee felt unstable because it completely buckled and gave way. Now, when we're talking about that because of an arthritic reason, what I use as an analogy is that if we were walking on the beach, you and I together, and we were barefoot, and you almost stepped on a broken seashell, you would, while we're talking, kind of do the chicken dance and fall off to the side. And I would look at you like, hey, what happened? And you'd very quickly say, oh, I almost stepped on a broken seashell. That happened in like a billionth of a second. Like supratentorially, your brain, I'm on a beach, I'm walking barefoot, I stepped on something sharp, must be a seashell. I don't want to put full weight on the leg. So it shuts off your quadriceps mechanism, your thigh muscle, because it doesn't want you to put full weight on the leg because it thinks you're going to cut your foot. So your knee buckles and gives way, but it's not due to a ligament instability issue. It's due to a pain response that sort of occurs above your consciousness. And the same thing happens with arthritis. Sometimes because of arthritis, if you imagine there's sort of an arc of the thigh bone or kneecap or shin bone, there might be a patch of just raw bone. And you bend or turn or twist and you hit that patch, and your brain says, this is going to hurt if I put full weight on this. So I'm going to shut off this person's muscle so they don't put weight on my leg, and then the knee buckles and gives way. We do not have a brace that fixes that. Sometimes strengthening lessens that instability feeling or sensation. But again, it's a symptom due to the arthritis. Now, the other analogy that I use, which is more of like this sharp, sudden pain, is what happens sometimes when people get sharp, sudden pain followed by immediate swelling. So, how many times have you chewed food? Probably billions. How many times have you bit the inside of your cheek? And it happens. You don't do it on purpose. You don't know when it's going to happen. And sometimes if you do it because it's swollen, you're more likely to bite it again at the next meal. Well, that lining of your knee, which I talked about, the synovium, can get pinched. It can get pinched between the bones, or if you have arthritis, between the bone spurs, or if you have a knee replacement, between the plastic and the metal. So you turn or twist and you put pressure on the knee, and that tissue just gets pinched for a split second. It causes immediate pain. And sometimes because that tissue, especially in an arthritic knee, is very vascular, it can bleed. Even worse if you're on blood thinners, and then the knee blows up like a balloon. So we treat the swelling, we treat the inflammation. Sometimes we'll drain the knee, but it's due to just that tissue being pinched, and we can't necessarily fix that. Now, sometimes we'll fix it if you have, say, an arthritic knee that is loose. When we do a knee replacement, we tighten it up so that's less likely to happen. Or if you have a knee replacement that's developed looseness or laxity, and this happens frequently, we can put a thicker plastic in to tighten it up. But most commonly, it happens once or on rare occasion, and it's just a thing that happens. Because what I've learned from talking to people over the past 20 years is people want answers. Sometimes we can't always fix things, but they at least want an answer, a way of understanding why something happened and will it happen in the future, and is there anything that they can do to prevent it? Because we're pretty good, but we're not geniuses. Like, we don't know the answer to everything, physicians. And the technology that we have available today honestly is good, but it's not great. It doesn't solve every diagnosis. We can't always explain everything. So I've found that these little analogies and metaphors at least give people an idea of what happened and why, and it takes away some of the fear or anxiety that people have when they have knee pain and other symptoms. So I really hope that you found this information helpful. I have a few other videos coming out sort of along the same vein. You're going to see one coming up where I'm going to share what x-rays look like of all of the different knee implants that are sort of currently on the market. A lot of people are always asking, what do I have and what does it look like? So I'm going to show that to you. I'm going to go into the details of why you don't need an MRI, most likely, and what is a meniscus tear when you're over the age of 50 and what do you do about it? And that Baker cyst, and kind of summarize those things. I've talked about them in some other lectures. And the other thing I want to share with you, because I've covered icing and ice machines in a previous video, but one of the newer things that we're using on a more regular basis, and patients seem to be doing really, really well with it, is what we call cryocompression. So these are ice machines that also have compression built into them. And these patients are starting to have better results from using this type of device. So things that I'm going to cover in the videos in the next few weeks. So again, if you haven't already subscribed, please subscribe. If you enjoy this content, give me a big thumbs up, share it with your friends. And until next time, I'm Adam Rosen. Thanks for watching. Stay safe.